Hello, everyone. Welcome to Pediatric Grand Rounds. Really excited about our topic today and looking forward to a great presentation. And I'm going to hand it off to our Vice Chair for Medical Education, Dr. Sandrine Van Schaik, to get us started.
Hi, everybody, and welcome. It's really a great pleasure to welcome our speakers today, starting with Dr. Emily Frank, who is one of the graduates of our pediatric residency program and has a pretty unique role in our community as both a teacher, an advocate, and a pediatrician. Dr. Frank began her career teaching seventh grade science in Vallejo, California. She developed a passion for helping youth while she was there, and particularly helping them develop health literacy and health advocacy skills. And that ultimately led to her joining Tufts University School of Medicine for medical school training through the main track program. She then came to UCSF for the PLUS program, the Pediatric Leadership Advancing Health Equity Residency Program, as I'm sure many of you are familiar with. And throughout her residency, partnered with the Oakland Unified School Districts to develop youth healthcare advocacy and career exploration initiatives. And so it was a pretty natural, though unusual choice for her natural choice, but for other pediatricians, unusual choice to actually after residency to take a job at Life Academy of Health and Biosciences, which is a public 6th to 12th grade school in Oakland. And there she works as a health teacher and pathway co-director. She also is an adjunct professor at Merritt College and on the side, still a pediatrician in the emergency departments and many of children's hospitals, Oakland and Mission Bay. She's joined today by Donald Woodson, or Don Woodson, who is the director of the Center for Science Education and Outreach at UCSF. Mr. Woodson has a very broad background in student engagement, recruitment, outreach, and is a very staunch supporter of equity in higher education and health careers. He's been involved with efforts for more than 25 years to create, implement, and direct various programs that expand pathway access and encourage success for underrepresented low-income first-generation students and families. They really span the K-20 educational continuum with the intent of increasing the number of underrepresented students interested in entering STEM careers. And then they are joined by several of the students that Dr. Frank works with. And Dr. Frank will introduce those students herself, but those are the other faces that you will see on this Zoom webinar. So without further ado, I'm handing it over to Dr. Frank.
Thank you so much. I am just looking for presenter view or play from start. There we go. Thank you so much for having us today. It is really a pleasure to be able to share with you some of the work that we're doing at Life Academy in Oakland and highlight some of the really amazing volunteer efforts from UCSF. And then most importantly, to share with you some of the voices and words of the young people who inspire me every day. This talk is called Igniting the Spark Through Extending the Pipeline. In terms of disclosures, I know that I, as a clinician, am not used to seeing pictures that are fully identified where I can see the eyes and the nose and the mouth. And so I want to reassure you that all student photographs where you're able to see a face have received permission from the student and the parent if the student is still under 18. I also need to disclose to you, I do own a small amount of stock in companies that manufacture PPE, which will not relate at all to this talk today. In terms of our objectives, we have two objectives for today. The first is to illuminate the ways in which UCSF has been impacting Oakland youth health literacy, health advocacy, and career development outside the walls of the clinic and the hospital. The second is to inspire you all, the viewers, to consider ways to personally and collectively broaden and deepen this work. In terms of what we'll be talking about, we'll start by hearing from Mr. Don Wilson about where we've been and where we are now. Then I'll show some examples of health literacy and health advocacy, as well as some examples of workforce development through my school Life Academy. Then we'll get to hear student perspective from 3 young people from Life Academy, and then we'll talk about what's next. From here, I'll hand it over to Mr. Don Woodson.
Hi, how are you all? Thank you for having us. I really appreciate it, for being able to have the opportunity to come and talk about this very, very important topic. As you can see on this slide, as you may know, there has been a lack of African-American, Latinx, and Native American populations working in healthcare. The issue is not just a Bay Area or California issue, it's a national issue. But unfortunately, it is highlighted even more in California and the diverse Bay Area because we are such a diverse population. The other unfortunate thing, as you can see on this slide, is there is definitely a disparity in the way that between the total workforce as well as those that are entering and are in STEM careers, particularly looking at the Asian population, the white population in comparison to the African-American, Hispanic, Latino, or Latinx, and the Native American populations. What's really sad about this is that this has not really changed in the past 15 years. So we have to truly think about ways strategically to move the needle on this. And I do believe that in UCSF and at UCSF, we have been doing things to make attempts to move that needle. Next slide. To address these issues, over the past 8 years, thanks to the Office of Diversity and Outreach, Vice Chancellor Renee Navarro and the School of Medicine's Differences Matters Pipeline Subcommittee Group, UCSF now has a better understanding of the importance of pipeline programs play in eliminating health inequities. There are a number of things: internships, job shadowing, career talks in classrooms, career panels. Not only do they provide opportunities for the students, but it also allows students to have the chance to go home and share these experiences with their families. And in other words, building trust with their families in the medical careers. So that's a very important component. You see that there are over 60 K through 16 pipeline and pathway programs at UCSF. 40 are San Francisco focused, but more importantly, none of them have an Oakland focus. In other words, there is not a sustained presence of UCSF pipeline and pathway programs in Oakland. Now, that is something that Dr. Frank and myself are really working hard on, and we truly need your help to think thoroughly about this and strategically about how we can solve this issue. Through a number of these initiatives, we have been able to hire a pipeline manager, which is great. And his role is going to be to help expose as well as expand some of the pipeline and pathway opportunities at UCSF. And the goal is then to move forward in expanding that, working with Dr. Frank to expand that as well as in Oakland. So we're looking very closely at ways to bring UCSF into more of a prominent role in the East Bay, particularly in Oakland, where UCSF is expanding a lot of services. Dr. Frank.
All right. So the first thing I'm going to share about is improving health literacy in an effort to activate health advocacy. And I'm going to share with you a few of the many examples from our school. I'm going to share a little bit about what we've done with influenza and COVID education and advocacy, with first responder skills through our Emergencies Day and through a bone marrow transplant registry drive. So I wanted to start by grounding us in what health literacy is. And so the Patient Protection and Affordable Care Act from 2010 defines health literacy as the degree to which an individual has the capacity to obtain, communicate, process, and understand basic health information and services to make appropriate health decisions. We know that health literacy is very much connected to healthcare outcomes and healthcare access. We also know that almost 36% of adults in the United States have low health literacy, and these percentages are even higher in low-income communities. So the first example I wanted to share relates to influenza vaccine and COVID safety. And for the second year this fall, we had guests from UCSF come. We had Dr. Rosny Daniel talk about what someone very ill with influenza looked like. We had Dr. Omar Salman and Dr. Tiana Woolridge from the Department of Pediatrics talk about vaccines and how they work and vaccine safety. And all of them focused on how especially important the influenza vaccine is this year. And the students were really inspired to get the word out, not only to their families, but to the wider community. And so what you see here is a flyer designed by a student. The students felt very strongly about making them available in as many languages as possible and peppering their social media to get the word out about how important the influenza vaccine is. And so they launched a campaign in early November that went through early December, trying to improve influenza vaccination rates in our school community. That all was sparked by a single talk from professionals. In a similar vein, students also embarked on COVID advocacy projects this past spring, about 4 weeks after school shut down, as we were just beginning to learn what COVID was and how it might be transmitted. And here's a student who was inspired to spread the word through creating graphics. Most students did graphics in their native languages. And flyered their communities with information about what COVID was and how to keep safe. And so you can see a reflection from this student stating, I put flyers around my neighborhood so that when people walk around, they can hopefully notice them and take the time to read information. I picked this topic because I see lots of people in my neighborhood that are not wearing their mask properly, or they aren't social distancing, and it puts everyone at risk. And I felt it was important to remind people to stay safe and stay healthy. And then when asked to reflect on this project, this student noticed that people in the community were stopping and reading the flyers. And she says, it made me happy because they were getting educated and keeping themselves and others safe. And she not only saw people taking this action, but she saw her role in this. She said, it felt good because I was helping my neighborhood and helping them not put others at risk. And so again, a little bit of health literacy can inspire a lot of health advocacy. Another example I'm going to talk about is first responder skills and what we called Emergencies Day. And so 2 summers ago, this article was brought to my attention. Bystander CPR less likely for Black kids in poorest neighborhoods. And this article made me very sad and also very upset. We know that CPR, bystander CPR can play a real impact on ultimate outcomes and mortality and morbidity. And this is a problem that should not exist. And even with the layers and layers of structural racism that exist, this is a problem that should not be hard to solve. And so it was partially through this and some conversations with colleagues in the emergency medicine department that inspired what we called Emergencies Day. And so prior to Emergencies Day, I gathered some data from my students. I asked them how comfortable they would be responding to an emergency on the street, with 5 being very comfortable and 1 being not at all comfortable. You can see that almost 53% of my students felt somewhat comfortable, but very few felt more comfortable than that. I also asked them if they knew how to recognize when someone needed CPR, and you can see that only 8.5% were able to recognize in their own perception when someone needed CPR. Another 67% thought maybe they knew. And then you can see that only 3% knew how to give high quality CPR prior to Emergencies Day. Also, none of them knew how to use an AED, and only I think it was 2 students knew how to recognize anaphylaxis, and I believe these are the 2 students who had anaphylactic allergies. And so we were really fortunate to have 21 volunteers, primarily from the UCSF Department of Emergency Medicine, as well as a group of EMTs at UC Berkeley who are connected to the disaster fellow at UCSF. And these volunteers provided 1 day of workshops for students where they learned how to give high quality chest compressions, how to use an AED, how to recognize choking in infants and older people, how to recognize and respond to anaphylaxis using an EpiPen, how to stop the bleed, how to recognize a stroke and effectively call 911, how to recognize an opioid overdose and deliver Narcan, which they were actually given Narcan to take home after their training, and how to design a splint using home materials. A few pictures. This is Dr. Jeannie Noble going over how to recognize choking and how to respond, and each student needed to demonstrate that they were able to do it. Down below, we have a UCSF alum, Dr. Tiffany Cobb, and Dr. Eric Isaacs, who works in emergency medicine at ZSFG, having a conversation with students about CPR and playing Staying Alive and having them practice over and over and over again high quality chest compressions. Here you can see a student is learning how to splint another student using cardboard and tape and other home materials. So this was a great day. But was it effective? I would venture to say yes. So on the left is the pre-emergencies day data, which is subjective. But what you can see is following this day, students felt much more comfortable responding to someone having an emergency on the street. In terms of being able to recognize when someone needs CPR, we went from 8.5% being able to recognize to 73.6%, and a large portion that still said sort of. We increased the number of students significantly who knew how to give high quality CPR. We increased students' ability to use an AED and to recognize anaphylaxis and give an EpiPen. We saw similar data for each of the different areas, but we didn't rely just on student perception. We also asked them objective questions to check that they actually understood symptoms of anaphylaxis or proper ratios when giving CPR compressions and breaths. But this data wasn't the real assessment. The real assessment came about probably 4 to 6 weeks later when a student became unresponsive during their humanities class. And normally when an emergency happens at school, mayhem breaks out, students are screaming and scared and running around. But when this happened, a student went over, shook the student on the shoulder asking, "Are you okay? Are you okay?" And then when they weren't getting a response, sent a student across campus, across the courtyard to find me. They asked their teacher to check a pulse and to check a sternal rub, and they began looking online as to what might be going on. This, for me, was the real assessment of Emergencies Day and the value in being able to introduce students to these first responder skills. Imagine if every graduating senior in Oakland had this skill set. If they were not only empowered to act as a first responder, or perhaps even seeing themselves as somebody who could administer some level of medical treatment, but how might it impact health outcomes in the community? A third example was our cancer and bone marrow transplant registry drive. And so with this event, we had, again, a number of UCSF volunteers come and speak with students. We had Dr. Goxinen, who is a hematology oncology fellow. We had Dr. Salmon. We had Frances Alba, who is a nurse on BMT on C6. And they spoke with students about cancer and about bone marrow transplants. And students also learned about the disparities of being able to find a donor by ethnicity and how much less likely African American or Black or Latinx or API or American Indian individuals were to find a donor compared to white individuals. And this again was a problem that we felt like as a school community empowered to take action on. And so we partnered with Be the Match, who has a large bone marrow registry. And we worked on creating advertisements. You can see a poster made by the student here. We did a lot of social media blitzing. And then during conferences, we held a BMT registry drive. And it was really the students who took ownership of this, who recruited volunteers, who spoke with them about the process and answered their questions. And in result, we were able to obtain 71 new donors in the Be the Match registry, most of whom were non-white donors. Unsolicited, a lot of students shared that they were committed to becoming donors once they were old enough. They were very angry that they weren't old enough. And this really increased the number of students who began seeing themselves in a health or public health profession. This year, we had our highest percentage yet of students entering our healthcare and public healthcare pathways. And so what I hope these three examples have illustrated is that sometimes it just takes a drop to spur a wave of action. The next thing I'd like to talk about is career exploration and development. And this is one of my very favorite photos. It is from a healthcare careers conference, our first one that we held several years ago at Life Academy. We host it at Life, but it is open to youth district-wide who are interested. And this student on the right was one of my 7th graders. And he is a wonderful human being, very animated, loves science, barely ekes by passing his classes. And he had decided to skip his soccer game so that he said, this is important, this is my career. I'm missing my soccer game, I wanna go. And he is listening to the heart of Dr. Anthony Muru, who is a nephrologist at UCSF, who grew up in Oakland and became a summer student through the Children's Hospital Oakland research program. And for him, that was his entrance into the field of medicine. And so he was really eager to come and meet with students. And you can see in this picture, he and my student are looking at a textbook talking about the heart and different heart sounds. And this opportunity for this student was life-changing. After that day, he decided he was going to become an oncologist. Besides being a student who struggles a bit with reading, he took it on himself that summer. He got his hands on every biology textbook he could and read it. He started emailing me about oncology articles, some things I had no idea about. And this year he's my 9th grader and he's taking his education really seriously. When students had the opportunity to read a news article, he chose to read the article about the COVID vaccine trials and describe data tables to his 9th grade classmates. And so for this student, this interaction right here was a spark that has led him towards what I think is going to be a really amazing career. As I mentioned, we've twice had Healthcare Careers Conference. The majority of our volunteers come from UCSF. We've had upwards of 50 UCSF volunteers annually. This is soon to be Dr. Caleb Edwards, a future neurosurgeon, teaching a student how to suture. After this day, she began considering a career in surgery. Here we have our emergency medicine department demonstrating what a code or a resuscitation might look like. Here we have Mateo Rutherford, who is an interpreter and brought an entire staff of interpreters to speak with students about pursuing careers in medical interpreting, many of which none had even realized might be a possibility for them. You can see a student here learning how to check a pulse and take a blood pressure. Here we have 2 students meeting with Dr. Martha Tesfalol, who's in maternal fetal medicine, learning about women's health. And here we have Dr. Ruiz Cordero, who's one of our pathologists, and there's like another 3 pathologists in the picture. Their station was such a hit, and students really got to develop an appreciation for the microscopic world, as well as what pathologists do. There have been a lot of other events that I don't have time to highlight. More than 30 UCSF staff have participated in one-on-one informational interviews with students exploring various careers. We've had so many talkers participate in monthly events for our healthcare and public health pathways, as well as come in and speak with the 9th graders related to various units they've been studying. Twice we've been able to bring our 9th grade class to the simulation center, and many of you have supported students in practicing delivering difficult information. We have had student panels from various graduate schools at UCSF, and we've had opportunities to take our students on field trips to the School of Nursing and the School of Medicine. And each of these touch points, no matter how small or how big, each of these touch points I really see beginning to ignite a spark for young people. And so at this point, I'd like to stop talking and let you hear from some young people themselves about their experiences. So for student perspective, we first have the opportunity to hear from Esmeralda Pena Sanchez, who is a 10th grader at Life Academy and an aspiring pediatric oncology nurse.
Hello, my name is Esmeralda Pena Sanchez, but I go by Emmy, and I'm a 10th grader at Life Academy, Oakland, California, and I'm a first-generation daughter of a Mexican and Guatemalan immigrant, and I have 3 siblings, 2 dogs, and a rat who reside with me in the 80s in Oakland, and I'm an aspiring pediatric oncology nurse, and I will be the first generation in my family to enter the healthcare career. And last year, our whole 9th grade class had a day called Emergency Stage, where we learned skills from EMT nurses, emergency medicine doctors, and I learned how to do CPR, use an AED, and stop major bleeding and how to recognize a stroke. I also learned how to recognize and treat anaphylaxis with an EpiPen and how to give Narcan to someone who has overdosed. And I think this is a great and important experience because there are a lot of things that I learned and that could be helpful. And I feel empowered to help in this kind of situation in the future. I also taught my family members skills that I learned from the emergency medicine doctors at home. And I feel like this is important for young people to learn about because the types of these things happen every day. And while they might not be happening here, it's important knowledge to know that can help in the future. And before high school, I was a bit interested in healthcare, and the jobs that I knew about were doctors, pediatricians, surgeons, vets, and EMTs. And this year I took a course where I was able to learn about different careers in healthcare. And I had an opportunity to do an informational interview with a nurse anesthetist from UCSF named Unique Layler. And I never heard of this career. And I had the opportunity for her to take time out of her day to come and teach me and help me learn about this career. And now I know that there is another option available for me to choose from.
Thank you so much, Emmy, for sharing your perspective with us. Next, we're going to hear from Allison Fulgar, who is a 12th grade student at Life Academy and a future anesthesiologist.
Hello, everyone. My name is Allison Fulgar. I'm a senior at Life Academy in Oakland, and my pronouns are she and her. I was born and raised in East Oakland to Guatemalan immigrants. My father works in construction, and my mother stays home with my younger brother and me. This coming fall, I will be the first person in my family to go to college. For as long as I can remember, I've always wanted to work with people, but it wasn't until I had the opportunity to spend the last 2 summers learning about future medical career options that I realized that I wanted to enter the field of healthcare. 2 summers ago, I was accepted to a nonprofit program run by undergraduates at UC Berkeley named Helix. Through Helix, I had the opportunity to shadow different medical providers at several UCSF sites. So some specialties that I was able to shadow were orthopedic surgery, internal medicine, and anesthesiology, which I realized that I want to pursue as my future career. I was able to continue exploring the field of medicine through an internship this past summer at Canbar's Simulation Center. There, I was able to support simulations and refresh my CPR skills. This experience reinforced the feeling and thought that I belonged in healthcare. I was able to see the behind the scenes, that there were more than just white doctors and nurses, and that there were people who looked like me in healthcare. I thought I wouldn't be able to go into healthcare because you normally don't see people like me, from immigrant families working in non-entry level positions in healthcare. It pushed me to want to become an anesthesiologist even more, and I want it really badly. I want to become that person for a future me who sees me as a physician and realizes that they can do it as well.
Thank you so much, Allison, for sharing with us. Our final student speaker is Kamaya Oliver, who is also in 12th grade at Life Academy. She is a future neurosurgeon.
Okay, hi everyone. My name is Kamaya Oliver, and I am a senior at Life Academy in Oakland.
Kamaya, we can't quite hear you. Are you able to speak a little bit louder or closer to your computer?
Can you hear me a little bit louder now?
That's much better. Thank you.
Okay, I'll just hold it. Okay, so hello everyone. My name is Kamaya Oliver, and I am a senior at Life Academy in Oakland. I and my family are from East Oakland, more specifically the Deep East. My mother is a bus driver, so I will be the first in my family to attend a four-year university and the first in my family to enter the field of healthcare. Currently, I am aspiring to be a neurosurgeon. My first health careers conference took place during my 10th grade year of high school. After experiencing the careers conference, I am confident in saying that those conferences were the most meaningful experiences in my high school career. To be able to experience such a variety of healthcare careers and professionals provided me a true insight of who I wanted to become in the future. Before experiencing the Health Careers Conference, I knew I wanted to be in the medical field, but I wasn't sure what career. This conference showed me that there are enormous varieties of options. For my rotations, I chose pathology and surgery out of interest, and I randomly chose neurology. After these rotations, I finally knew working in a lab or becoming a pathologist was not the right fit for me. The health conference helped me narrow down my options in terms of my career aspirations. Holding the brain during one of my sessions provoked my interest enough to reach out to the people tabling at the summer program session about brain camp. Immediately, I was enticed and knew I wanted to apply. Out of over 400 applicants, I was one of 30 to be accepted into UCSF's summer brain camp, and I loved every bit of it. The camp was a week-long immersive experience which focused on providing a variety of academic opportunities to underserved high school students throughout the SF Bay Area. During my time as a student of the camp, I studied the anatomy and physiology of the brain, how the brain is included in the study of living organisms, and the complex interplay between mind and behavior. I got to experience college prep workshops, a panel discussion with UCSF college students, hands-on activities such as suturing, brain dissections, and performing a basic neuro exam. I loved it so much that I applied to become a student leader and work closely with the founders and other leaders of the Brain Camp in an effort to provide a virtual brain camp to the attendees of 2020. It was through my experience at Brain Camp that I discovered my calling to become a neurosurgeon. These programs and resources were life-changing for me, and I feel so lucky to have had these experiences to help shape my future. In my community, I rarely see much relating to the healthcare field or promoting healthier lifestyles. It is hard to imagine professionals who come from Deep East Oakland, yet I know with an extension of the programming and resources I've been able to take advantage of, we can we can inspire a far more diverse workforce in the future. Thank you.
Thank you so much. I only wish that I was as talented as the youth that just spoke. They're honestly the reason why I've been doing this for the past 20 plus years. And it's very clear that you can see and hear the passion and the impact that these opportunities have had on them. And I'm positively sure that they left a lasting impact on the researchers, faculty, health professionals that they have come in contact with during their experience. What's really important though is we want these experiences to continue. And while there are many challenges, including funding, one of the lower hanging challenges that you can directly help us with is the lack of industry access and expertise. We need job shadowing opportunities, speakers, panelists. I mean, your expertise and career paths are important stories to provide another brick in that path. There are a number of UCSF departments that have contacted me brainstorming on how to provide support to the already existing programs or to create sustainable opportunities within the department, their own department as a part of their diversity initiatives. So I encourage you all to think about the various things that you have heard, think about how you can think of supporting them, and feel free to contact me. Next slide. So a couple of things to think about. How might you as an individual, your department, improve health literacy and inspire youth health advocacy? How might you individually, your department, increase opportunities for exposure for all these students? How might individually or your department also strengthen the opportunities for longitudinal growth, including for those who have not yet found their spark? So I invite you to be a part of these pipeline and pathway programs. We want you, we need you. We cannot do any of these programs. These programs would not exist without your support. So I encourage you all to continue to support, as well as to think about ways how we can further work with each other to support these youth and bringing some of these youth onto this special and amazing careers in healthcare. Dr. Frank.
You would think I would be better at these tech glitches, having now been in nearly a full year of distance teaching, yet that's one I always run into. If you are interested in getting involved, we have basically put together just an interest form. It's not committing you to anything. It's just getting a survey of who is out there that would like to volunteer and be connected. You can share if you're, interested in giving a talk or mentoring, or perhaps have a shadowing opportunity. Or if there's a great idea that you have, Mr. Woodson is an excellent thought partner and his email address is here. I will drop the tiny URL in the chat shortly, but I absolutely wanted to take some time for acknowledgements. This work takes a village, and there are so many individuals that I could not fit them all on one slide, but so many folks, both in the Department of Emergency Medicine and the Department of Pediatrics, who have volunteered their time and energy to support this work. I also wanted to recognize the Department of Pathology, Department of Women's Health, the Children's Hospital Oakland Residency Program, the Department of Anesthesia and Pharmacy, the CanBar Sim Center, the Highland Sim Center, the groups of EMTs at UC Berkeley, and so many more individuals who have helped this work happen. And so I'll leave this slide up, but open it up for questions.
Emily, Don, Kamaya, Allison, and Esmeralda, thank you so much for just a fantastic overview of the great work that you're doing. And I will start by just saying that if I listen to the three students, I have the strong feeling that the future is in good hands. And if we can find more students like this to take over from us as pediatricians, then we have an excellent future ahead of us. I'm going to encourage people to ask questions in the through the Q&A feature of the webinar. We will also send out a tiny URL with the link to the recording of this webinar. And maybe while people start pondering their questions, I will kick it off with a question for the students, because we were encouraged by Don to think about, like, you have a great idea, email Don. But if it was entirely up to you and you would have additional opportunities, um, like a make-a-wish kind of thing. What is it that we as pediatricians or Department of Pediatrics could offer for you that would be a meaningful contribution to your experiences? Sorry, I'm putting you guys on the spot.
I think I'll go first if that's okay with everyone else. I think personally, I would benefit a lot from hearing talks or having like panelists and being able to hear from people firsthand. I think that would help out, as in the sense of how I would be able to kind of contribute, well, not contribute in a way, but kind of feel like I'm present and feel included. And I feel like that would help me and a lot of other students kind of step foot into healthcare without like physically being there because of the limitations with COVID and everything. In a non-COVID like setting, I would definitely say having shadowing experiences or just like being able to talk to a healthcare provider for even 5 minutes is definitely something that can impact you in the long run. I know it was definitely like that in for me personally. I wasn't the type of person to want to go into healthcare. I was always shying away from healthcare. I thought it was more like, well, you know, if you have money and you have the opportunity to go to college, then you're going to be able to do those things. And kind of being able to shadow an anesthesiologist and shadow all these different healthcare professionals, it really gave me that push and that motivation to kind of want to do it. And I do think that those would be two great options for students.
I'll go second. Just like Allison said, I agree with everything you said, like exactly. Um, for COVID, I definitely would say talking to students more specifically about the journey. I feel like a lot of students, and myself included, are very confused on how to get there and like what steps you take, what is it like. So just speaking about your journey, what was medical school like? What college did you go to? What did you major in? What was everything like? So I feel like that would definitely help. Just talking to the students. We're nice. And then for in person, I would also say shadowing. I also had an experience with shadowing, and by or and also being able to see what exactly is there. So by being able to hold the brain and witness a brain dissection and dissect a sheep's brain myself, it was just I love hands-on activities, and I think they really help students want to do that activity even more. It's different than just speaking about it when you can actually experience it like hands-on, or for at least for me. But yeah, definitely.
Adding on to theirs, like I agree with them too. And also like summer programs and like mentoring, because it's like what they're saying, hands-on, and like getting to learn like how you get to where you are, like where you guys are right now, is very helpful, because like I really don't know where to start, and I really want to go into a healthcare career. So like summer programs and like mentorships could be very helpful.
Thank you. As you guys were speaking, and things roll into the Q&A, and you'll be happy to know that it already has inspired a few people to volunteer. So, you know, um, but there's also a couple of questions, comments that I think deserve further attention. So Dr. Jackie Groep-Velen, who is our division chief for pediatric emergency medicine, says, thank you, Don and Emily and the fabulous students. This was fantastic. One of the challenges has been on the administrative side to get students across to clinical sites, access to clinical sites. It would be very helpful to have this process be more streamlined. This is so important. Shadowing has historically been more available to those with connections, and making this more accessible will be important to lessen the disparity. Don, Emily, can you comment on that and how we can maybe help solve some of the issues around there, or what needs to happen to make that easier?
Yes, I'll go ahead and take this. So a part of the job of the pipeline manager is to really take a look at the policies and procedures for students that are coming into their health internships or job shadowing. And with the guide of streamlining and figuring out better ways to do that. I know if the students are coming through a UCSF, established UCSF pipeline or pathway program, I know, for example, with the Center for Science Education and Outreach, we handle all of the paperwork. We do all of the paperwork. We take care of all of the training, which allows the department and or the research lab to really just accept the student and provide the experience. So it really is working with some of the existing programs to look at better ways to streamline that process, but really to take the burden and the responsibility from the department to be able to host those students.
So Don, just so I understand correctly, in other words, if people have an interest in hosting a student, contacting your office would be the best way to orchestrate that.
Absolutely.
Emily, you were going to add something to that.
Yeah, I was just gonna add that Dr. Phelan brings up such an important point. And so I hope that we institutionally can think about how might we streamline this. There are a lot of like medical legal things that need to be thought through, but it doesn't mean that we can't put our heads together and do it to make this experience more accessible. The other thing I wanted to bring up is particularly for our students who live in the East Bay or Deep East Oakland, public transit can be very difficult, or it can take many legs of public transit to make it into a UCSF site. And so when programming is designed, to really think about, as you budget, how can we also budget to help students with transportation, so that those who may live in a public transportation type desert can still access the same opportunities those living in a more urban space might be able to access.
Thank you. I think that's a really important point. Dr. Meg McNamara, a residency program director here at UCSF Mission Bay, has two questions. I'm going to ask them one by one so that it's a little easier for you guys to keep track of it. So the first one they're both for the students, is can you reflect or give some feedback on concentrated shadowing or concentrated educational experiences as they compare to longitudinal mentoring relationships? Is one better than the other? Do you have a preference? What are your thoughts?
I think I can go first again. I've had experience with both. During Helix, I was able to do kind of just, it was a 2-week program type of thing. So I was able to shadow different healthcare providers each day. And for me, I think it was good in the sense that I was able to have more exposure to different people and different settings and different UCSF sides. And every person has something different and has their own, how do I say this? It's like their own way of teaching when they have students shadowing. So I think I personally might prefer the long-term mentorship. Last summer, since I was able to work at Kanbar, I was able to, work with Wes, and I was able to also work with Jenny. They were amazing. They were able to kind of have that one-on-one, even though with restrictions of COVID, we were all trying to, stay 6 feet apart and still try to talk to each other. I'm still in contact with them to this day, and they're always like, hey, are you doing okay? How's college going? Like, are you still looking into these colleges? I heard that you wanted to do this and that because you were talking over it in the summer. And I think long-term mentorship has a really big impact. And I think it's had a bigger impact on me, especially since no one in my family has ever been able to work in healthcare, has had that initiative, or has had the contact with people to be able to, work in healthcare, be able to get me shadowing experiences. And I think that having that mentor, even though they're not necessarily someone who is in the established field that I want to go into, is really important, because I feel like I have someone who I can kind of rely on in a sense and be like, hey, like, I know that this might not be your place of specialty, but I have a question around, how I might be able to do this, or if I can work with you, or if I can come back to Sim Center to do something. And I do think that having that long-term mentorship is amazing. Like, I think that that has been something that has really impacted me and what I want to do. And I think that if other students who are probably not as lucky as me to have had, the opportunity to do these internships, have the opportunity to do an internship or have a one-on-one like shadow experience where you can have a prolonged period of time where you can talk to someone who can essentially become a mentor is something really important that I think that I would definitely say is my preference, and I would tell other students to do it if they had the chance to.
Oops. Okay, again, I'll go second. So I'll talk about the shadowing. So I shadowed physicians and other clinicians in Highland Hospital with Hill. So it's an internship where you basically shadowed doctors and such. I was able to shadow people in the micro lab, in the OR, and also in possibly the step down, step up, something like that. It was absolutely amazing to shadow them, especially the surgeons in the OR. They were hilarious. It was really great. So I really enjoyed it, but I do remember shadowing a nurse while he was making like his rounds or something. And it felt like he didn't really want me there or wanted to teach me or have me around. So, I definitely felt that. So having like being with the other surgeons in the OR, they felt like they wanted to teach me. They wanted me to see. They told me like, hey, come closer a little bit. Hey, how are you feeling? At a point I like got a little dizzy and I needed to get some water. They're like, it's absolutely okay, go get some water and you can come right back. So having those experiences where they want to teach you really matters. Like I hated, like I felt like I was just stuck with the nurse, like he was just in such a grouchy mood. And of course, maybe he was tired or something. I don't blame him, but to be with people who wanted to teach me and who wanted me to learn and who wanted me and saw me in those careers and those futures, it was amazing. And it felt like people cared about me in a way. And it was just amazing. Um, and in terms of for the other question about people who are more established in their field or near peers, I would also just say just people who want to teach or know how to talk to students or don't mind talking to students. I know a lot of people say, oh, I hate kids, I hate high school students. It's okay if you want to talk to us, if you want to teach us, that's all we need. Because we can feel it when you don't want to teach us, and it hurts. It definitely hurts. But yeah.
So I'm not sure about this question because I haven't had the opportunity to do this yet. So I'm not really sure.
If I could just add on to Cami real quick, I definitely feel that, like, I don't know how much I can emphasize Cami's point with being able to shadow someone who wants to teach you. Like, there were definitely times where we would regroup with Felix after having shadowing experiences and going over and being like, I had this really poor experience with internal medicine. She didn't really want to talk to me. She was kind of just like, do you want to come? Like, you can stay here if you want. It's kind of like you're really put in a position where you have to be there because you want to learn, but there's someone who doesn't want to teach you. And it's like, sometimes I don't blame them. Like Cami said, like sometimes people are having bad days and, we're all human at the end of the day and you have your own profession. And I know that I'm just a high school student in a sense, but just having someone acknowledge you and trying to like fill you in with what they're doing is really important. Like, not just me being there, but having the person who is ultimately giving me the shadowing experience is going to determine how I feel about the field. If I go into internal medicine, right, shadowing this doctor or shadowing, I don't know, whoever's there, and I'm just like, I feel completely dismissed by the doctor, I'm going to be like, wow, is this what, if they're treating me like this, I wonder how I'm going to feel in this field, or I wonder how I'm going to feel when they interact with patients. Like, those kind of thoughts go through your mind a lot of the times. And it really sucks when someone doesn't want to teach you, kind of feel like you're forced to be there. So I definitely do think that what Cami said is really important, to have people who want to teach. So, yeah.
I hear that loud and clear. Luckily, I don't think there are many pediatricians who don't like kids, so that part is taken care of. But yeah, I totally hear. There's no point in shadowing if people don't really pay attention to you, because then you really become a shadow, and that's not quite the idea behind shadowing, right? There's a few more comments on the chat. Ellen Fung from Corey is highlighting some of the opportunities through that center, and the also saying thank you for the incredible tireless work you do for the gifted youth, and always open to collaboration. I also should highlight that Dr. Colin Partridge, who's a very well-respected neonatologist at our institution, is offering his assistance and mentorship. So he's very popular. So I'm sure he's going to be a trendsetter, because Colin does it, we're all going to do it, right, Colin? I think that actually is what we have for open questions and comments. I don't know if Emily or Don, you have any closing comments? Any other things that you want to bring up before we hand it back over to Dr. Hirsch?
I wanted to wrap up with 2 final thoughts, and then I'll pass it over to Don. For those of you who are not familiar with distance teaching, to get a young person to come off their microphone and especially to turn on their camera is a feat. And so I just want to take a second and recognize the tremendous amount of courage it's taken these young people to not only turn their microphones on to a bunch of strangers, but also to turn their cameras on. And then what I'd like to leave you all with is I hope that today got the wheels turning. And this is a long process, but I encourage you to start those conversations with your colleagues. Whether it's a talk, whether it's something bigger, just to get the wheels turning and to start speaking with your colleagues. And this is where ideas come from.
And I just want to echo what Emily said. I am very just so impressed with the youth that spoke today. And not only that, but the honesty that they showed in discussing their experience, and the importance of having a positive experience. And the other thing is, and I mentioned this earlier when I was speaking, is that yes, this is about the students having experience with UCSF. But I also have to say, this is also about UCSF having an experience with youth, and youth having the opportunity to trust UCSF. So I think there is a win-win on both ends. And the more we can take advantage of it to support youth, the better. So I'm excited about what's happening in the future. Thank you.
Very good point. Again, thank you all very much for being here. And Emily, I will definitely be in touch with you. I bridged the role of CAMBAR director and a pediatrician, and we're going to do some really fun things virtually and then hopefully soon in person as well. Dr. Hirsch.
Thank you, Sandrain. Well, I want to extend my thanks to our presenters today. This really was a very inspiring program that you have, and it was great to hear the experience that the students have had. And I hope we can partner with you moving forward to extend these programs. So thanks again, and I want to wish everybody a good rest of your week. Be well.
Thank you.